Vibhavari Naik ma'am to the session. She is a senior consultant onco-anesthesiologist from Basavatarakam Indo-American Cancer Hospital. She is a renowned and eminent speaker. She has delivered various sessions in national and international forums. Over to you, ma'am.
I wish to thank the organizers for inviting me here, and it's quite heartening to see so many people at this time in this hall. Thank you for being there. I bring greetings from my hospital, Basavatarakam Indo-American Cancer Hospital and Research Institute, Hyderabad. And this is a 600-bed standalone cancer center, and we've been doing about 8,500 major cancer surgeries every year. As a department that takes care not just of onco-anesthesia, but also the surgical critical care, pain and palliative medicine, we also train the youngsters. We run fellowships in onco-anesthesia, which are both the Indian College of Anesthesia and the Society of Onco-Anesthesia and Perioperative Care accredited. And we also have an FNB in onco-anesthesia. Now, can I have a quick show of hands knowing how many of you get to anesthetize patients who need to undergo Hipec procedures? Yeah, thank you. A few of you. But for the rest of you who are sitting here, I'm sure you're wondering, why? Why do I need to sit in this lecture? Why do I need to know this? So, the first statement that I want to give to answer this question is that the incidence of cancer is increasing. It's increasing worldwide, it's increasing in India, it's increasing at a faster rate than you and I can imagine. However, because of improvement in the treatments, because of improvement in the skills, the knowledge, the understanding of the way the cancer behaves, the equipment that we have, we are able to perform more extensive resections, and we are able to treat these patients with more aggressive chemotherapeutic regimens. And hence, we are here to embrace new treatment protocols, one of which is Hipec, which combines resection of extensive tumors along with intraoperative chemotherapy. And I'll talk about it in the next couple of minutes. Also, more and more centers have started doing the cytoreductive surgery and Hipec. I know at least 20 centers in India that have been regularly doing Hipec procedures, and I'm sure more centers are going to do, one of which could be yours. These cases are extremely challenging and they require precise management, and hence the need to understand that. Now, making it very simple, what does Hipec stand for? Hipec is nothing but hyperthermic intraperitoneal chemotherapy. So this is direct administration of highly concentrated, mind you, it's 100 to 1000 times concentrated chemotherapy that gets delivered to the cells at a temperature of 42 degrees centigrade, and it's given directly into the peritoneal cavity. There are two ways that it can be done. It can either be an open technique. I'm sorry, the pointer is not working, but the top one is the open technique, and the closed, where the abdomen is temporarily closed after cytoreduction to be able to give chemotherapy. The essential prerequisite before Hipec is started is that all the visible tumor should be removed. So a complete cytoreduction is a prerequisite. So, but what does really Hipec do? After you've removed the macroscopic tumor, Hipec actually helps to eradicate the microscopic tumor cells, which means tumor nodules which are smaller than 1 millimeter in size, also loosely adherent tumor cells on the peritoneal surface. That's because surgery itself can promote cancer spread. When the tumor is handled, a lot of tumor cells get spread and they fall into the peritoneal cavity. and of course the free floating tumor cells in the peritoneal fluid. So this seems like it's sounding very good, right? Yes, it does. It does help us eradicate the microscopic tumor cells, but to be able to translate into better survival rates, we need to make sure that the significant hemodynamic and metabolic alterations during Hipec and in the early post-operative period are taken care of in a very precise manner, and that is going to actually increase the survival rate. And I am going to talk about only the intraoperative aspects today. The indications typically are peritoneal malignancies, which is pseudomyxoma peritonei and peritoneal mesothelioma. However, certain malignancies which have a high incidence of spread to the peritoneal cavity, like the ovarian and the colorectal, are something that we also do in our institute. However,